My name is Shivani Dhakal. I'm a student nurse from Emergency Department and I'm handing over to the med team. This is Mr. Jason Bilko, an 81-year-old male currently living at 1 Soft Street, Chowtown with MRN 123456 and has nil-known allergies and is currently under Dr. Turner. He was diagnosed with pulmonary edema after being present to the ED and at the moment is rousable only by pain. His latest observations at 1800 hours are blood pressure 180/95, his heart rate is 125 beats per minute, he's saturating at 84% on 6 liters of oxygen via Hudson mask, his respiratory rate is 33 rests per minute and has a temperature of 35.7 degrees Celsius at the moment. He was brought in by ambulance at 1600 hours today with chest pain and shortness of breath. On arrival, he had a respiratory rate of 32 rests per minute and was saturating at 82% on room air. He did not complain of any pain on arrival and was initially admitted under Dr. Lance and has had previous admissions for unstable angina and has a history of multiple falls. On examination, at 1620 hours, patient was alert, his blood pressure was 138/72, his heart rate was 101 beats per minute, he was saturating at 88% on room air, his respiratory rate was 28 rests per minute and his temperature was 36.8. He did not complain of any pain at that time and was commenced on 6 liters of oxygen via a Hudson mask. ECG was attended and he was attached to a cardiac monitor. A normal sinus rhythm was noted and he was reviewed by Dr. Lance. He then had an IV cannula inserted at his left cubital fossa. His blood test was done and his obs were attended again at 1645 hours. His blood pressure was 132/68. His heart rate was 98 beats per minute. He was saturating at 97% on 6 liters oxygen via a Hudson mask. His respiratory rate was 16 rests per minute and he had a temperature of 36.8 degrees Celsius. Dr. Lance was notified of the observations and he was commenced on normal saline 1000 meals at 10 meals per hour at 1700 hours. His chest x-ray was done and he was reviewed by Dr. Turner after he came back from the radiology. He was commenced on IV furosemide 40 milligrams at 1800 hours and his observations were noted at 1800 hours and he was escalated to Dr. Turner and rapid response was activated.